Welcome back. The CDC has determined the Delta variant is now a, quote, variant of concern, a designation given to strains of the coronavirus that scientists believe are more transmissible or can cause more severe disease. Currently, the variant, which was first discovered in India, accounts for about 10% of infections in the U.S., but some experts are worried it could become the dominant strain. The Delta variant is also producing different symptoms than what we've become accustomed to hearing about over the past 15 months. In fact, the symptoms are very similar to a summer cold, which is also going around right now. So how can we tell the difference? Dr. Donnie Aga with Kelsey-Seybold joins me live. Good morning to you. At the start of the pandemic, the symptoms we were watching out for were cough and fever and loss of taste and smell. So what are the common symptoms of the Delta variant?
Well, good morning. And obviously everyone today is now reading about this new Delta variant, which circulating right now in the United States is about 10% of cases. With unmasking in the community and more people going out and with summer vacation, we are definitely seeing more and more of these summer cold type symptoms and upper respiratory tract infections. And like anything else, the COVID virus is in that cold virus family. So the symptoms can be very similar to cough and cold. Now, how do you tell the difference? Well, if you've been vaccinated, most likely, if you come down with symptoms, you probably have the regular summer cold. And you should just monitor your symptoms and then maybe report that to your doctor. But if you're unvaccinated, most likely you have COVID and you need to get tested.
Okay. And doctor, I'm going to have our director pull those symptoms back up for us again, because I think what's interesting is that the loss of taste and smell for the Delta variant doesn't even make the top 5 here. So it looks like fever and cough, the traditional COVID symptoms, are actually lower on the list. Is that what you're seeing with this Delta variant?
Yeah, and we'll learn more as we see more patients. We do know from the experience in Europe and in India that this variant is definitely more contagious. It's about 60% more contagious and is more likely to cause severe disease. So it is a more virulent strain than what was the original strain, which is the alpha. And so, yeah, it is difficult to tell the difference between a common cold or just a runny nose, sore throat, not feeling well, low-grade temperature, as opposed to whether you have COVID or not. But I think that the main thing that we want patients to know is that, and the CDC has told us this as well, that if you're vaccinated, then we think of other things first. And if you're not vaccinated, the first thing you have to think of is COVID, and you should be tested. The other thing is a reminder that if anytime you feel ill or sick, then you should stay at home. Consider if you're going out in public to wear a mask, start to social distance again until you know whether you're contagious to others.
Mm-hmm. I'll tell you what, in full honesty here, I got a summer cold a couple weeks ago. It was awful. It knocked me off my feet, and it was right around the time that I, started coming back into the office and wasn't wearing my mask as much anymore. So are our immune systems weaker because I had spent the last year basically distancing myself from others? Is that what you're thinking, that perhaps our immune systems might be weaker and we're trying to build back up again?
No, I don't think that at all. But what we do know and what we're seeing is that since we're not masking and we're going out in public, those things we didn't see this winter, so cold and flu, we're going to start seeing. And we're starting to see that now. We're seeing much more respiratory conditions in the clinic than we had previously. They're non-COVID related. And actually, probably the most common respiratory infection right now is not COVID. It's non-COVID infections in our vaccinated population.
Mm-hmm. That was me. All righty. Well, thank you, doctor. Appreciate you coming on and informing our viewers about this. Have a good day.
Thank you.